I think just as much as the doctor has a role and the nurse has a role, we as the patient have a role to make sure that we get certain tests done, that we follow up with different people who are on our team, and making sure that we are part of that voice when they look at our management, because we have a lot to share. Okay, we're going to look at the guidelines and around patient self-management. We're going to talk about our role, what we need to do, and what support is there to help you. So when we talk self-management, there's two components. There is us and our self-management, and then there is how does our healthcare team, and our team, I say that very loosely because we might have other people in our community that support us, and what support do they offer us? And how do we meet them to work on that? So we're going to talk a little bit about that. So first I'd like to give you the stats on chronic disease. So it's a global challenge. In 2014, 38 million deaths were due to chronic health conditions. So the most standard ones that we see are cardiovascular disease, cancers, chronic respiratory like COPD, asthma, and diabetes. 28% of this was in the high income countries and people under the age of 70. So we're getting younger with our chronic health conditions. And it is, since 2000, it went from 31 deaths to 38. So it doesn't seem like a lot, but when you think it's 31 million to 38 million, that's a lot of deaths. So what can we do to help ourselves and prevent that from occurring? In Canada, we have 10.7 probability for Canadians between the ages of 30 and 70 with a chronic health condition. 14% of Canadians over the age of 20 have 2 chronic health conditions. And as you notice, there wasn't many of you that just had one. You had a couple chronic health conditions. And even people over the age of 20, 4.9 have multiple, more than 2. And then there's also the population of 4 out of 5 Canadians actually are at risk for developing a chronic health condition. Thank you. In our LHIN, there's 33% of the Toronto Central LHIN, where we're sitting today, and where you took your self-management course, live with a chronic health condition. What I'd like you to notice is actually they're over the age of 12. So our youth are now suffering from chronic health conditions. 14% in our LHIN have multiple conditions, and 18% ages 65 to 74 have heart disease, as the rest of the province, cancer is the leading cause of death. But I think what's interesting also, and it might be because of our pollution and the cars that are driven here, is that we have the highest death rate associated with asthma. The idea of the the LHINs, there's 14 of us across the province, is to actually get better care within our area, to really focus on the community that lives there and give them the best care. So they're looking at how do we deliver better care? How do we prevent people from re-entering emergency visits? How do we get them a family doctor, which can be a problem, and they're really working hard on that one.